Welcome everyone to the National LGBT Cancer Network's webinar. We're really excited to be hosting this event today with some amazing leaders from across the country. We are expecting some more folks to join on, so we will get started shortly. In the meantime, if you feel comfortable, we would love it if folks would introduce themselves in the chat box on the platform, just so we can get a sense of who's joining us today. I see lots of folks introducing themselves in the questions panel. The chat panel should just be below that. So if you could introduce yourselves there, that would be great.
Hi all, it's a little after 3 o'clock and we have about 85 people already here with us today, and everyone's still introducing themselves. This is awesome. So thank you so much for coming today. I am Karen Naimul. I'm with the National LGBT Cancer Network. I am the membership coordinator for our tobacco-related cancer project and also the director of operations for the National LGBT Cancer Network. And today I have some racial justice leaders whose work I have admired for many years. I'm so happy to be able to have this conversation with them and to share the National LGBT Cancer Network's platform with these amazing LGBTQ leaders of color to talk about the work that they're doing in our communities. as well. I have my colleagues, Michelle and Aria, with me, who are part of an amazing team. And during the time of this pandemic, we've been using our resources to give a voice to our community members who've been really struggling, because we know that LGBTQ people need our communities to thrive, and that we're at higher risk for most diseases, and we're so vulnerable that this pandemic we know is impacting our communities significantly, but we also know that we're not counted. And part of the work that we're doing at the Cancer Network is to let people know that we exist, have them understand how we struggle and how we're particularly vulnerable for most diseases. So I'm just going to have my coworkers introduce themselves so that you get familiar with the people who'll be talking to you in our chat box. And then we'll have our presenters say hi, and then we'll start the presentation.
Hi, everyone. My name is Michelle Veras, and I'm the project director at the LGBT Cancer Network, and I work here in Pawtucket, Rhode Island. So welcome, everyone, and I'm so excited to talk with the presenters that we have today. I've been really looking forward to putting together this webinar. I have been seeing lots of stuff focused on people of color or queer folks, but the intersection has been something that I think is really missing from the conversation. So again, just really excited to have you all sharing today.
Hi, everybody. My name is Aria. My pronouns are she, her, hers, and I also work at the Pawtucket office in Rhode Island, but I live in Massachusetts, right over the border. And I'm also super excited to be having this webinar. It just kind of intersects the two things that are most important to me in my life. And this conversation definitely needs to be had. Additionally, I will be the person in the chat box. So if you have any questions, if you're having any difficulty with audio, please reach out and let us know. The more that we can make this experience better for you, the better it is for everybody involved. So thank you all for taking the time to be here and be a part of this really crucial conversation.
So Karen, I am going to go back to the slides and you can take it away.
Awesome. So I didn't mention my pronouns. I use all pronouns. Can we get the next slide, Michelle?
Sure. Here we go.
And so just some ground rules. I know that this might be an unfamiliar platform for many of you. Please feel free to introduce yourself and the organization you represent or in our chat feature. If you have any questions, you can raise your hand or add it to the chat or the questions panel, and Aria or Michelle will respond. If it's a question directed to our presenters, they will let me know and I will ask them. Please use your headphones. You'll get the best sound. It'll also reduce feedback if you have an opportunity to speak and ask questions. We know that in this time of COVID, most people are moving all of their operations to virtual chat rooms and meeting rooms. And so your bandwidth might be challenged by the bandwidth of all the other people who are using Wi-Fi in your area. So please close some of your browser windows to help optimize the connection. And we're going to have a questionnaire at the end of the webinar. Please fill it out. The more of you that fill it out, you give us more information that helps us be able to advocate for LGBTQ people in the work that we do. So please let us know who you are, what your interests are. Please answer a questionnaire. Just by doing that simple act, you're supporting many of the orgs that are on this call right now. You guys will watch Michelle turn each page. So the National LGBT Cancer Network is a national org, and part of the work we do is we are one of the CDC's 8 disparity networks, and we operate the Tobacco-Related Cancer Project. And so we invite anyone across the country to sign up, let your organization become a member of the network. It is free, and what we will provide to you is technical assistance around working with LGBTQ communities around health disparities related to smoking cessation and cancer, tobacco-related cancers specifically. We'll provide you with resources. If you are an LGBTQ org and you want to partner with your Department of Health in your county or your state, we can facilitate that relationship. So feel free to send me an email if you're interested in joining our network. We know that LGBTQ people are more likely to have coping mechanisms that impact your health, and smoking is one of them. And we know that we tend to start smoking much earlier in our life course. And the earlier you start, the more likely you are to become dependent on those substances. So we know that especially in the time of COVID-19, smoking makes us even more vulnerable to this disease because it impacts our lungs and our breathing. Michelle, next slide. I'm really proud of this. For every webinar we've done during the time of COVID, we've created some shareable materials so that organizations who join us in our webinars have access to a social media toolkit to do outreach with LGBTQ communities. And these are specifically to talk about people of color communities. We know that wearing masks don't make brown and black people feel any safer. It actually makes us feel more terrified to walk around in public. And we also know that there have been very recent incidents, multiple incidents that have put black and brown people in danger from wearing masks that are supposed to be keeping others safe. So we have created these 3 shareables. If you're interested in partnering with us on creating something else specific for your community, send us an email. If you go to that website on the bottom of that slide, you can see the other toolkits that we've put out with regards to LGBTQ people and COVID-19. Michelle, next slide. And so I'm really excited about today's presenters. Again, what we've been doing is trying to build that bridge so that LGBTQ communities can talk about our higher risk and higher vulnerabilities during the time of COVID. Because as Michelle mentioned, we have reports on LGBTQ people being at higher risk. We have reports of Black and Brown and Hispanic folks and Indigenous people being at higher risk, but very rarely do we see that intersection. And so we've had the opportunity to invite racial justice leaders across the country doing amazing work in their communities to talk about the impact of COVID and what they're doing to address that in our communities of color. So we have our three of our 4 presenters on right now. I think Candy brings plenty, hopefully still trying to join us. But if my 3 presenters can just say your names and your pronouns and say hi, and then Rae, you're going to go first. So we'll have our conversation after your other 2 co-presenters introduce themselves. So Vanessa,
so
you want to
introduce yourself?
No, well, Vanessa and then Mohamed, and then Rae, you can introduce and stay on.
Okay. Okay, I guess I will introduce myself. Hi, everyone. My name is Vanessa Flores-Maldonado. I am the co-executive director for the Providence Youth Student Movement located here in Providence, Rhode Island, and my pronouns are she, her, hers.
Thanks,
Hi,
Vanessa.
everyone. I'm Mohamed Q. Amin. I'm the executive director for the Caribbean Equality Project, and we are a Caribbean LGBTQ immigrant rights organization based in Queens, New York.
That's awesome. Thank you so much. Could I ask Vanessa and Mohamed if you can just turn off your video so that Rae and I are on the screen just to preserve bandwidth?
We will see you shortly. Thanks.
Hi, I'm Rae Leiner. I'm the executive director and co-founder of the Newburgh LGBTQ+ Center.
Thank you so much, Rae. Could you just tell us about the Newburgh LGBTQ Center, some of its history and the work that you do?
Sure. So the Newburgh LGBTQ Center started organizing me and my co-founder, Maria Ramirez, who is a long-term Newburgh resident, Mid-Hudson Valleyer, got together and we started to have community-based conversations about the need for spaces for queer people of color. I saw in the chat box that there are some folks from In Our Own Voices in Albany. Whoop, whoop, yeah. We recognized that between the city and Albany, there were no resources that center the voices and leadership of queer people of color. We started to organize in 2016 by convening a community-based process to have people in the community talk about their needs and identify their needs. We convened that process for about 4 days non-consecutively, and were able to come up with the Newburgh LGBTQ Center. And just to really address the needs and disparities for queer people of color, being able to find space and resources in places that saw us, understood the nuances of where we're coming from culturally, and also understood more gender expansive and sexuality expansive ways of holding people in the community that we weren't really finding, or we weren't really able to access as folks that were so far away from strong organizations that were building in much more densely populated areas. And so we started off as a really small grassroots group, started off by hosting community-based events to get people to come out and to build up our base. And from there, we've been taking an approach of interdependence and decentralizing power to address the core issues that end up impacting us systemically. So those core issues focus around housing instability, workforce discrimination, access to healthcare, being able to be treated well when you're going to receive healthcare, spaces for leadership development, because a lot of our folks are really just awesome and just need support, like need each other to be able to access the kinds of support necessary to navigate systems. And so we have a really robust leadership development program. We have a core group of organizers that range from folks that are our board members that we depend on and love a lot, to folks that are volunteering their time, to folks that are starting to get paid because we're starting to have money to be able to pay people, because it's something to volunteer, but if you are a queer person of color and you don't have access to a job consistently, it means that you might be giving your time to an organization. And we all need volunteer-based folks, but we also need to figure out ways to support our folks when they are not able to access dollars that they need, or even like basic resources like personal hygiene products, or access to somebody who provides mental health counseling that is trusted, that you can make a referral to. So we've kind of found ourselves in this place where we started off in Newburgh and recognized that our folks were not just living in Newburgh. We also were located in the Mid-Hudson Valley, so that's about an hour north of New York City. And we also live in Beacon, which is right across the river from Newburgh. We also live in Middletown, which is a half an hour further into the interior of Orange County. We also live in Poughkeepsie, which is about a half an hour further north. We also live in New Paltz. We also live in Kingston. So this year was supposed to be the year where we were rebranding and starting to build chapters of folks that are queer people of color that are interested and engaged and interested in systems change, and is interested in holding service providers accountable, and interested in doing the cultural competency education, and interested in holding those spaces down for people in the community. And we started growing, we started building and growing. And this year we were so excited to start a chapter in Poughkeepsie, and we still have our folks in Poughkeepsie, but we've had to do a lot of shifting based off of the needs of the community. We do a lot of centering the voices of people in the community and create spaces to talk and engage with folks to figure out what their needs are. So we're not just putting out things and being like, yeah, you should adjust to this, but adjusting what we should be doing in order to better serve the needs of the community. So that's just a little bit about us.
Sorry. So I mean, you brought up so much, especially equity, right? We know that queer people of color are struggling just to have access to the basic needs to be able to survive. And that's one of the foundations of the Newburgh LGBTQ Center. Again, you mentioned that you're in an area where it sounds like it's really spread out, right? So it's a little bit more rural than dense city areas. And so how has this pandemic interrupted your work? I mean, I know for us at the Cancer Network, we've seen that it's sort of like really shed a light on the health disparities that we keep telling people exist. So just if you can tell us a little about like what you've seen, how it's impacted the community, and then also how has that changed the delivery of the work that you do? Like how has it impacted the center and the way in which you organize?
Yeah. So first, we have relied really heavily on social media in order to spread the word so that way people get information, right? Because everything is so spread out, we're in this kind of hybrid space of like urban rural mix, maybe even like a little suburban that's up in there. And so we already were using social media as a tool to be able to reach folks in the community. However, the impact of not being able to go out into the community and be able to meet people on the ground has really shifted some of the work that we've been doing. So we had done, for example, a power analysis at the beginning of the year, and the group had decided that we wanted to work on tackling transportation in City of Newburgh to start with, but we recognize that City of Newburgh is limited in their ability to be able to make harder decisions when it comes to budgets and budgeting, and that is taken up by Orange County. And so we recognized that we were going to have to mount a campaign with other organizations in coalition to be able to raise our voices in a strong enough way to then talk about this issue. And so we were gearing up, getting ready to like get our survey on and ride the buses and talk to people at bus stops and talk to people on the streets and talk to people who are working, who use public transportation. And so we're not able to do that, right? One of the asks that we had is, looking at models for how people can access things like transportation. In the Mid-Hudson Valley, there is no coordinated transportation. So if you don't have access to a car, and you don't have money to be able to take a cab, then you can't get to places, and it's very challenging. And so for our folks, a number of our folks actually rely on the busing system to be able to get to work. What has happened is that we are not able to engage people on the street in the same way because of social distancing. And I mean, that's real. The organizer that we had working on this particular project was a frontline worker and worked in a grocery store before they were infected by COVID-19. It's interesting, we're not even that big of a group, yet almost half of our folks have been impacted by COVID-19 and have been sick, have been laid off from their jobs, have not been able to access completely unemployment supports. And so we're seeing the impact of how this works in our community, because reaching out to people using the internet is a great way to start engagement, but really we know that face-to-face contact, that getting to see somebody and getting to meet them, sitting down and drinking a cup of tea, maybe even going for a walk, building a relationship with them, it's so much more challenging to do that work and to engage in that work in an effective way. And so what we've been able to do at this moment is we have pivoted at least our leadership tools and leadership development work onto an online platform. So we have active Facebook and Instagram, and don't talk to me about Twitter because I don't know how to work Twitter that well. So that way people are still able to access those kinds of spaces and be able to still be in community with each other, despite the fact that we are doing it through the internet. And what we also learned was that a number of our folks who like outside of our direct group, are not able to do things like pay their internet bill, pay for their medication, pay for transportation to get to doctor's appointments or critical appointments that they have to make it to. And so we work with one of our funders who pivoted and has supported us, and I'm just going to name drop them. They're Jesse Smith Noyes Foundation, who made emergency funds available to us. And also the North Star Fund has made emergency funds available to us. And we are days away from rolling out a queer relief fund to give mini grants out to people in the community so they can do things like pay for their internet, pay for whatever it is that you need. We don't need to police you on the things that you need to survive. We just need to know that there is a need there, and we can at least give some of that funding out into the community to try to support people as they're struggling with uncertainty. We partnered with Legal Services of the Hudson Valley to provide a series in April. We're in May. In April, that happened once a week for folks to get information about eviction, right? That's like a huge anxiety that many of our people are dealing with at this point. Is if I don't have this job and I'm not able to access unemployment, how am I going to pay this rent, right? Like how am I going to make it at this moment? And a number of our folks are, you know, performers, gig workers, sex workers, undocumented, you know, working in essential jobs that weren't paying a living wage to start with. And so we knew that we had to get these dollars out the door. So we have worked with our funders and we're making this fund available, and we're really excited. And we also know that what we're able to put out there is a drop in the bucket in comparison to the real needs. And like one of the images that you all showed before we started this conversation about how COVID has really helped to unmask those systemic fissures in our society that allows our folks to just slip right through the cracks. You know, at the cross section of us being at that place, like this was really for us like I guess a come to Jesus moment for other folks to maybe see or get a sense of what people in the community are dealing with and what their extended community is dealing with, their families, the way that it's impacting the community. Sometimes we have the pleasure and privilege of having family that we've been born into, but a lot of us have chosen family
Right.
because our families don't always love us and they don't always support us. And so we figure out a way to survive, and we're just trying to figure out a way to survive and to take as many of our folks with us as possible.
Rae, thank you so much. We have a question, but I also wanted to ask you if, you know, once you address this question, which is what is the age range of your organization's participants? The other thing is just like, you know, you're talking about the support that you were able to get from these foundations to offer queer relief. If, you know, for our listeners today and anyone who views the video of this after, what is some way that an ally can support the work that you're doing? So what's the age range and how can people support the work that you're doing?
So we are pretty diverse in the age range, but we're actually a pretty young organization. Like we have a lot of folks in their early 20s up through their 40s are the folks that are engaging in the work that we're doing, which for the area is it's really interesting. I find that in the spaces that I've been in that have been organized spaces or organizational spaces have mostly engaged folks that are in older age range, and a lot of folks that didn't necessarily come out until later on in life. And so I wouldn't say that we're a youth organization, but we are youthful. And I know this beautiful face is probably deceptive. I'm pushing 40. And so I'm excited that we are able to bridge the gap for younger people who are queer, who are people of color, and also white allies and co-conspirators to be in the space together, which feels very different outside of being like in the city or like a more populated area. So there's that. And then we are, as we are launching, my folks are like sending me messages because we're just finishing up graphics for putting out the Queer Relief Fund. So we're going to be fundraising for the Queer Relief Fund. There are two campaigns that we are pushing forward right now. One of them was directly supporting a Black trans woman who has become a key member in our organization, who fell into a diabetic coma at the beginning of last year, and has no bio family willing to claim her or support her, and we stepped up to support her and have been doing support work for her ever since then. And she was released from rehab this year, and we had worked really diligently with service providers to try and get her into supportive housing, and the option for her when she left rehab was to go into the shelter system. And so we have a fundraiser to keep her in her apartment for the next year. She's navigating disability. It's a very complicated story. We have lots of materials that are going to be rolled out for fundraising specifically for that. And then there's the fundraising for Queer Relief. And that is going out into the community in the form of mini grants. So those mini grants are ranging from $50 to $200. We have those materials that we are getting ready to launch and start accepting donations for in like the next couple of days. I'm very excited about that. As we are promoting this this fund to folks, and also thinking about ways to make sure people get access to that information, so it's not just online. I mean, we're in a time of social distancing, but I can social distance, put up a flyer in a community and in a place where I know people will see it and will likely try to reach out to us in order to access that resource, right? So I can share information about how, if anyone was moved or interested and wanted to support the work that we're doing in the Mid-Hudson Valley, I can share that here.
Great, thank you so much. We're gonna move on to our next speaker, but Rae, if you could stay on for the call in case some questions come up later for you. Also, yes, if you follow the Newburgh LGBTQ Center on Facebook, you can see all the great work that they're doing, and you'll be able to support any of those projects or upcoming projects. Thanks so much, Rae.
Thank you.
Thanks, Rae.
And I think we're waiting on Mohamed.
Yes, Mohamed is up next.
Could you introduce yourself again and your pronouns and just, yeah.
Hi, everyone. I am Mohamed Q. Amin. I'm the Executive Director of the Caribbean Equality Project. I use he, him, they, them pronouns, but all pronouns with respect.
Thanks, Mohamed. Could you just tell us a little bit about the Caribbean Equality Project and where you're located?
Okay. The Caribbean Equality Project is located in Queens, New York. Our work is citywide. We don't have a physical location yet. The organization was founded in response to anti-LGBTQ hate violence in Richmond Hill, Queens. In 2013, my brother and I survived a hate violence incident. And in response to that, I founded the Caribbean Equality Project with Andy Bishun and Krishna Ramsaran in 2015. And we realized that there wasn't a Caribbean LGBTQ immigrant rights organization addressing the emotional needs, the supportive needs, the employment needs of our immigrant population. And through the support of the New York City Anti-Violence Project, I was able to get counseling. My family was able to get counseling. We were able to get legal support. And from that moment, I realized that there's really no resources available for Caribbean immigrants, for Caribbean Americans that are struggling to navigate who they are or to just navigate in New York City as new immigrants. So when we launched the Caribbean Equality Project in 2015, we started by creating our campaign, our My Truth, My Story campaign, and we documented 3 stories of LGBTQ immigrants. Most notably, we documented Dominique Jackson's story, who is a trans woman from Trinidad and Tobago, who is currently starring on Pose as Electra Abundance. And for the first time, we were able to share the experiences of what a trans Caribbean woman goes through, from being assaulted to being molested to migrating, doing sex work, survival sex work, to being an author and an actress and a motivational speaker. And the journey of Dominique Jackson was able to inspire a lot of our participants to step forward and say, I want to tell my story. I am a Caribbean immigrant. I am a trans person. My parents have abandoned me, and I've been living in New York City with my chosen family or finding spaces. But I also have an intersectional identity, being Indo-Caribbean or being Afro-Caribbean. My history, the history of my ancestors, whether it's through slavery or indentureship, impacts who I am today and what my immigrant experience is like. And today we have documented 5 of those stories. They're available on our YouTube channel. And we were able to address hate violence within New York City, within Caribbean communities in New York City. We were able to talk about the intersectionality of our queerness and our Caribbeanness through a multicultural lens that never existed for our community. There was never a space for Caribbean people to be vulnerable and live their truth in a way that was powerful, but also building community power at the same time. We also created Unchained, which is an immigrant Caribbean LGBTQ support group in New York City. It's the only one that exists for our community. And prior to COVID-19, we used to meet at the Lefferts Library, the Queens Lefferts Library in Richmond Hill. And when we started that in 2015, we used to get maybe 3 or 5 individuals. Like every month, it would be 3 or 5 people. And our last session, which was the first Monday of March in 2020, we had 23 people that showed up. And for the past 2 years, we've had either between 19 to 20 to 23 people coming to our Unchained group. And these are Caribbean immigrants that are living throughout New York City. Folks are traveling from Brooklyn, from Long Island, throughout Queens, from Staten Island. We have a queer member that travels from Ithaca, New York, once a month to come to Richmond Hill to be in a space that affirms who they are, but also to be in community. And through that program, we were able to create our grassroots action team. Majority of the Caribbean Equality Project's work is still very much volunteer-led. We're hoping to change that. We deserve to get paid. We call ourselves night organizers when everyone is catching up on TV or having a cup of tea or having intimate conversations with their partners and family members. My team and I are up until 9, 10, 11 at night having Zoom conversations and organizing and coordinating what the next project is that we're going to be working on. We also launched for War Pride, we launched a project called Queer Caribbeans of NYC. And through that project, in partnership with the LGBT Center, we were able to document 30 years of Caribbean LGBTQ history and activism in New York City, from visibility at the Pride parades to organizers like Kim Watson, who's from Barbados, a trans activist, to Dominique Jackson, to Colin Robinson, who is a pioneering Caribbean activist in New York City that now lives in Trinidad and Tobago. He founded Caribbean Pride out of GMAD, but he also launched a staple at the NYC Pride Parade called the Big Truck. And for the past 20 plus years, it is the only Caribbean representation at the New York City Pride Parade. And I'm so proud in 2019, the Caribbean Equality Project honored the legacy of the big truck by hosting it, attracting over 1,200 marchers, which was illegal. We got in trouble for that. But it
Good
also
job.
showed the need of Caribbean people to want to celebrate their culture, want to be in community with each other. And through our Queer Caribbeans of NYC project, we were able to showcase not only the history of our community that have existed in New York City, but where we are today. And we photographed 22 intersectional Caribbean activists, ranging from fake leaders to performers to drag queens to speakers and actors and actresses. And for the first time, the center had beautiful Black and brown, queer and trans Caribbean bodies illuminating a space that was not often welcome to our people.
That's really
And
great, Mohamed. That's
Thank you.
really great. I just want to say, last year for Pride, myself and my coworker Aria marched with the big truck. It was fantastic. We loved it. We recognized that there were a lot more people that should have that was allowed, but it was really great. So thank you so much. I know based on just the news that I've been reading that Queens has been really hit badly by COVID-19. Can you just sort of share like how that has impacted the work, as well as the community members that you organized with? And then, in this time of social isolation and social distancing, you mentioning this person coming from Ithaca, I guess now that, they're not able to do that, like how are you supporting people who would have to come from far and wide to come to your programming? So just share some of what's happened to your community with the impact of COVID-19 and how you've sort of adapted the work that you do and just what you're seeing.
Yeah, thank you. So as of today, there are over 57,000 cases of confirmed cases of COVID-19 in Queens. We've had over 5,769 deaths. My dear friend, Dizanne Romaine, who was the first NYC Department of Education employee to pass from COVID-19. She lived in Queens, she taught in Brooklyn. And for our community, starting in maybe the second, third week of March, we started getting emails. I just lost my job. My boss just texted me. I don't know what I'm gonna do. I am living in the shelter system. I am living in a single room occupancy. I'm living with my homophobic family members. But now I feel even more trapped and I feel even more scared. And in response to this emerging need from our community, we started a COVID-19 emergency relief fund. And we didn't know how we were going to support our community members. We didn't know how we were going to meet their financial needs. We didn't know how we were going to meet their emotional needs because our Unchained program was only meeting once a month in a physical space. And by launching our COVID-19 response fund, we were able to raise over $12,000 for our community members. But that's just a drop in the bucket. Starting last month, we started distributing that fund by creating mini grants ranging from $150 to $350 to assist community members with their rental expenses, living expenses, employment expenses, particularly for those who are working reduced hours. We have been funding their Metro cards to alleviate that financial burden from them. Food insecurity has been a major problem with our community. The issue of finding cultural food or just having access to food in Queens has been unprecedented. And for those folks, we have been sending them gift cards. Many of our community members that we're serving are undocumented LGBTQ folks. Some of these folks don't even have a bank account. We have been sending them gift cards and mailing it to them, making sure their mailing address is safe for them to have access to food. We also moved our Unchained program to a virtual space for the first time. And thinking about privacy and confidentiality, we wanted to make sure that we are still reaching our community members. And instead of having a once a month program, we're now having a bi-weekly virtual on-chain group where we are meeting more community members as far as California, Virginia, Guyana in South America, Trinidad and Tobago. Caribbean LGBTQ folks are tuning in just to be in community with us in New York City. We're currently planning a food pantry for Richmond Hill, Queens. Many of our community members are undocumented and documented, low-income, working class, Indo-Caribbean, and Afro-Caribbean folks. And for this community, we're seeing the need for food, and we are creating a food pantry. It's happening this Saturday. It's going to be a series that we do because that's the need. We have over 80 people that have signed up for food deliveries. We're estimating to have over 200 plus people that are going to show up on Saturday. It's a 2-day event. Saturday, May 16th, we're doing the pantry with distribution. And then Sunday, we're doing deliveries to folks who are impacted by COVID-19, seniors, folks with disabilities, folks who are impacted by HIV, and we don't want them to risk coming out just to have access to food. But the financial need for our community right now is far greater than what we ever imagined. And as an underfunded and under-resourced organization, we're even finding it challenging. Many of our leaders have been impacted by COVID-19. And as we're doing this work and as we are responding to our community needs, we have over 100 people that have applied to our COVID emergency fund. To date, we have only responded to about 60% of those folks. We have provided either $150 or $300 to those folks. We still have 40% of that list that we are currently fundraising to support. And if folks are interested in supporting our work, and I hope you are, you can go on our Facebook page and you'll see our fundraiser there. We have also partnered with the city. We have acquired over 500 masks, and we started a mask by mail program. And we are mailing masks to community members that are essential workers that still needs to come out to do their grocery shopping, that may need to go to the bank. We want them to be safe. And these are just basic needs, but many Caribbean LGBTQ immigrant folks can't even meet these basic needs in New York City.
Wow, I mean, it's so terrifying that this is New York City and you're talking about food insecurity. And we know that for New York City, Black and brown people are the frontline workers. They're the Metro North conductors, the MTA staff, the police officers, the teachers. It's a lot of Black and brown people that do that sort of like customer service work, that feed us, that take care of our kids. And so thank you for the work that you're doing. It's really scary that that you're handling 60% of this like deluge of like people asking for basic needs like food. And I think this is like something that we always talk about when we're talking to queer organizers, especially queer organizers of color, is that when you're helping out your community, you're still a member of that community and struggling just as hard as everyone else in the community. And you have an opportunity today. We have departments of health on the call listening. We have larger LGBTQ orgs on the call. We have LGBT centers across the country, as well as other queer activists and people of color activists, or queer people of color activists on the call. We have over 100 people on the call listening. If you can ask, for some kind of support or something they can do to assist or be allies in the work that you're doing, like here's an opportunity. Tell us how we can be an ally to support your work. I mean, we'll share your asks for funding. We'll visit your website. But if there's anything else, please tell us.
I'll start by saying if there are any funders watching this, when you see that application says Caribbean Equality Project, call me directly. Let me tell you about the work. For application, when you see it, learn about the work that we're doing. Visit CaribbeanEqualityProject.org. Search us on social media. You can search us at on Instagram at Caribbean Equality Project, on Twitter at Carib Equality, on Facebook at Caribbean Equality Project, and you will learn all about the work we're doing. You will see the need of what we're responding to. We are trying to survive a pandemic that many of our community members escaped from the Caribbean. Many of our community members escaped violence from their family, escaped harassment, and they wanted to survive in New York City. They wanted to thrive in New York City. And we are hoping with all of y'all's support that we will emerge from this pandemic to continue serving our community and continue to help them to thrive in New York City. Our support group is the only space for Caribbean LGBTQ immigrants in New York City. Through the partnerships we've built over the years with the LGBT Center and the New York City Anti-Violence Project, we have been able to also help our community with legal support. We have been able to help them file for asylum. From 2017 to today, we have successfully won 22 cases of Caribbean queer and trans folks in New York City. And every single program that we host is being organized by volunteers. Our organization is volunteer-led. Our grassroots action team is coming out to everything we do to support us. And we are moving and shifting our work in a way that our leadership could be paid to do this work. When you see that application coming in at 12:30 or 1 o'clock or 2 a.m., know that that's when we are working. And if you question why is this organization sending an application at 2 a.m., just know that that's the only time we have to do our nonprofit work, to serve our community, to respond to their needs, while also trying to maintain our own survival, our own jobs. And many of our leadership members are working reduced hours. And we have a young, amazing trans activist by the name of Sai Ali that's currently developing our trans justice program. And she has been a mentor to so many trans women that are migrating to New York City from the Caribbean. And we are connecting those folks to resources, trans-affirming healthcare, name change, asylum. These are all cases that we're working on a daily basis. And those cases are still happening. Immigration work is still happening in New York City. Our members, our clients are still getting emails. Oh, you have to go for your biometrics, or we're gonna send you an email with your name change delay. So our community members are scared. Many of the youth that we respond to are living in homes that we know are not safe. And for our Unchained program, for 1 hour or 2 hours, some of them are just walking around Queens, walking around New York City on their phone, just to be in community and to also escape a toxic home environment.
Yeah, we had Encopia on one of our earlier webinars, and they said what was really sort of stark again for them in terms of reality was that someone actually called into one of their support groups from a literal closet. They were hiding in a closet in the house because they weren't safe in their homes. And so, you know, for people listening to this webinar, like many LGBTQ people can't afford to live away from their homes, and this pandemic has sent them back to those same families and homes that have been very abusive. And, you know, it makes the mental illness, the depression, the anxiety even more prevalent from dealing with this. Mohamed, someone mentioned that food insecurity is the #1 issue called into NYC 311. And I know you brought it up. So I'm going to ask, if it's not food insecurity, what do you think is the biggest need for your community right now?
And actually, that's a great segue, because I also wanted to add the mental health aspect of COVID-19 is impacting our community in so many ways. We're currently providing mental health services, free mental health services to our community members every Tuesday, Wednesday, and Thursday. We are working with a Brooklyn-based mental health professional who we've developed a great relationship that knows the needs in the community, but we also need to pay him. We're currently not paying him. He's doing this for free just to help our community members. He's doing Zoom calls, he's doing Skype phone calls, he's doing FaceTime with our community members. And we want to be able to fund him. We want to be able to secure funding where we can say to him, be our consultant, be a contractor with us help our community. And we're seeing from our Unchained group that folks are scared. They don't know how they're going to pay their rent. We're seeing people are being harassed by their landlords. We are responding to those incidents. We are reporting them to the New York City Commission on Human Rights. And those folks are getting weekly and daily emails from us about these incidents of harassment. So in addition to food insecurity, in addition to lost income, in addition to sometimes living in a homophobic home, people are now dealing with the mental health of how to survive COVID-19, how to breathe, how to exist in an environment where a financial crisis is now compounding your mental health and your mental health wellness. And through our mental health service that we've launched, we've been able to reach community members throughout New York City. And we're seeing a lot of folks from Queens calling us. Queens currently, unfortunately, the suicide rate in Queens have doubled since COVID-19. And in addition to Caribbean immigrants who came here to escape violence, they're now living in a pandemic where violence is also thriving because of Black and brown bodies are still being attacked in New York City. When we walk the streets to go to the bank or to go find food or just to get some air, we're being policed and we're being attacked.
I know. It's very sad. We have a couple questions. I'm not sure if you can answer this. It says, compared to other vulnerable communities, how homophobic is life in the Caribbean? And I will tell everyone on the phone, like, I'm from the Caribbean. I'm queer, non-binary. I'm from Trinidad and Tobago, and it's fairly homophobic, but the Caribbean is also a very odd collection of people who will accept you while simultaneously rejecting you in a very interesting way. But the proximity to the US means that, Caribbean people travel to the US for school because the islands are too small to have all of the programs if you want to pursue a certain career. And a lot of us end up feeling safer in the US.
Just to add to that too, there are currently 9 Caribbean countries and islands with anti-sodomy laws where it's illegal to be gay or it's illegal to have any type of same-sex relations, same-sex intimacy. And that's just being gay, right? There is no acknowledgement of the trans community. Majority of the LGBTQ folks are being harassed on a daily basis. If you encounter anti-LGBTQ hate violence and you go to the police, you are further re-victimized because then they're making fun of you. There are no trans-affirming healthcare. My country, I'm Guyanese, I'm from Guyana. It is the only country in the Western Hemisphere with no LGBTQ rights. My brothers and sisters in the Caribbean are being fired if they're outed and if they're gay. There's no healthcare that affirms who they are. If they are doing survival sex work and if they happen to be HIV positive, there's no protection on that information. There's no confidentiality in that information. And it gets shared as gossip. And that in itself puts their lives at risk. And those folks, if they're able to get a visa, they are literally coming to New York City. The partners we have in Guyana and Trinidad and Jamaica and Barbados and St. Lucia, they are referring community members to us. I have this person who's coming, they got a visa to come to NYC, they're escaping violence, they're getting death threats. When they get there, can you help them? We have community members that are coming, landing at JFK, and we're referring them to a shelter. That's
Wow.
how severe it is living in the Caribbean. And then now we are dealing with a pandemic while also helping those same folks who was just learning to navigate New York City, but are stuck at home, stuck at the shelter, nowhere to go, trying to survive.
I know, given the health disparities that we're seeing in the US and in New York and all the other states that are on the call with, for LGBTQ people and LGBTQ people of color, it sort of really lets us know like these people are escaping even more physically violent spaces to come here because this is better, and we're still losing LGBTQ people to substance abuse, to disease, poverty, homelessness. And, we can see that discrimination in the health disparities that we experience. And, thank you so much for talking about immigrant populations. Like, this is the perfect sort of segue to have our next speaker, Vanessa, come on and talk about the work that PRISM is doing in Rhode Island. And so, just again, thank you so much.
Thank you.
If you can just stay on, Mohamed. So if anyone has questions for you, we can probably address that at the end. Vanessa, welcome.
Hi. Ooh. Okay, sorry. I'm just, technology and I have not been getting along today. So I'm trying, there we go, okay. Hi everyone, my name is Vanessa. I am the co-executive director for the Providence Youth Student Movement based in Providence, Rhode Island. And my pronouns are cool. Yeah, I mean, honestly, it's hard to kind of follow up Mohamed because like all of what he was saying, I was just like, yes, that is on point. It is an exhausting time to be an organizer right now. It's funny to see like all of this language about frontline workers and the way in which we're not talking about how grassroots organizations have really been stepping it up and really been holding it down for communities in ways that have just been it both makes me really sad to see, because I know that if it wasn't for these organizations, folks would not be getting all the help that they need. But at the same time, like you have the same organizations that are showing up to every Black Lives Matter rally, that are showing up to protest Pride because of their inclusion of police, or the same organizations that are already trying to bail, that have been trying to bail our people out of jails and detention centers. Now their workload has just exploded in ways that we were never prepared for. You just can't be ready for something like this. And it's just,
Right.
it's so
Vanessa,
much.
could you tell us about PRISM and what you've been doing in response to this pandemic?
Yeah, so PRISM, not prison, as many people mishear it, PRISM, Providence Youth Student Movement, is a grassroots youth organization based in Providence, Rhode Island. So we were founded back in November 2001. And so we're specifically a Southeast Asian organization because, so in Rhode Island, actually, we have a significant Southeast Asian population, refugees actually that came because of the American War in Vietnam. I myself am not Southeast Asian, I'm Central American, but it's still it's a lot to see a lot of shared history between Southeast Asian history and Central American history in the ways that this government has intervened on the behalf of democracy, or whatever lie they come up with, to basically completely overturn our homelands and create these refugee crises, create this immigration crisis that we're currently experiencing. So PRISM was born because of a lot of criminalization, detention, and deportation of Southeast Asian refugees who legally have the right to be here. But because of lack of resources, lack of help, lack of whatever, a lot of our people are in gang databases, are dropping out of school, are not able to find employment, are not able to find stable housing, right? This is stuff that existed before COVID. We were already dealing with some of these things of food insecurity, of lack of education, of language barriers. And now in the time of COVID, to still be dealing with this on top of this public health crisis that we've never could have, I mean, we probably could have if we had the right information, but this public health crisis that for some of us, we weren't prepared for. And so we are a youth organization. We define youth as ages 13 to 24. We do some intergenerational work, so a lot of our former youth have come back and have become other programs or still need PRISM's legal resources. Our programs are centered really around the abolishing the school to prison to deportation pipeline, because for us, that's how extensive the pipeline is. It doesn't just stop at prisons, it continues to detention and deportation, which we've seen in Southeast Asian communities. We've seen an almost 300% increase of the deportation of Southeast Asian refugees since this administration started. Deportation, criminalization, that's always been issues that our community has dealt with. The fact that we still have to deal with this during a public health crisis, the fact that our people are still being arrested, are still being detained, are still being expected to check in with ICE, there are no words to describe it. Like, it just pisses me off. Our people have enough to worry about, right? We're losing our jobs. Our youth feel completely and totally unsupported right now in the public school district. Our queer and trans youth, we have a queer and trans youth of color program called Queer Transformative Roots, also known as QTR. And so, you know, our queer and trans youth programming, they're just at a loss as to what to do, right? There's not just a lack of resources or a lack of technology, but there's just, you know, our people are just kind of broken and kind of done and over this, you know, like it's ridiculous. If it's not one thing, it's another. And right now our youth are feeling, well, what's happening here? What even can I do? What even power do I have in this situation? Because my parents are losing their jobs, my housing is severely unstable, you know, my friends are all like, I'm not connected to my school, to my community, to my friends, because we're all supposed to be at home. And you know, and to make matters even worse, Rhode Island is currently reopening, currently in the process of reopening, which I'm trying not to curse, but it's so infuriating, because we know that communities of color have been hit the hardest by COVID-19. This is a fact. Our governor has acknowledged it, politicians have acknowledged it, yet for some reason we're still reopening our state. So we have so many things we have to deal with, so many, like, you know, we have to make sure that how are our youth doing? We have to check in with them because they are the heart of who we are. So many of our members, you know, we were trying to start up a housing cooperative model for queer and trans youth of color. We were trying to re-envision what community wealth looks like. Those plans have to be put on hold. We're still in high demand in terms of providing legal resources to folks who have survived state violence, whether that's police brutality or harassment or ICE detention, deportation. So we still have those programs that are highly in use right now. And then you know, we as a small nonprofit have to figure out, what is our work looking like? What can we offer our community? It's overwhelming. And you know, our youth have said it best. They're just like, I don't know what to do. I don't want to do anything because I'm stuck at home all day, and whether or not I get along with my family, whether or not I get along with my roommates, at the end of the day, I don't have a home anymore, because that's what PRISM is to a lot of people. It's not just the, oh, I know I can like drop by and you know, pick up a meal or take a shower at the office, because we have all of these services that we give folks. You know, you have full access to our kitchen, we have a shower, we have napping areas. You know, anybody can come into this office and feel home. And when you take working on helping to fundraise, to make sure that people who in our base who are in need get connected to these resources. But it's a lot. It's a lot to put on an organization. It's a lot to put on individuals who not only have to still go to work, us, we're still coming to work, we're still doing the programs, we're still trying to meet with our youth, but also we are individuals, we are human beings who have our own lives, who have our own families that we need to take care of. So while I'm trying to figure out how do I fundraise for the award network, I'm also trying to figure out, should my uncle, what about my uncle's immigration status, while also trying to figure out, does my mom have enough resources, but also checking in with our, so it's a lot of things to handle, and it's overwhelming, but if we don't do it, who will?
Well, Vanessa, we have 94 people listening to our webinar. We lost them, but
That's okay.
You have an opportunity to have like very large LGBT orgs on the call. We have departments of health, we have maybe potential funders, we have people who can share your ask, like, what do you say is the biggest need? What kind of support would you need?
I feel like, and that's a very hard question for me, just because, or not a hard question, but it's just a question that I always just like, I don't know how to answer it, because our community is just so huge and diverse. And yes, Rhode Island is a small state, Providence is a small state or city, I hear that, but our community just has so many intersecting layers of needs, right? We are people of color who have to deal with police harassment on the regular, police who are currently in our neighborhoods not wearing masks, but still expected to enforce the law. We still have to check in with ICE because of our undocumented refugee status, but also the homophobia and the transphobia that we face from our community. So it's all of these layered issues, and I think something that folks need to realize is, yes, first of all, give me all your money. Donate everywhere, anyhow. The more local you donate, the better, because that's immediately being put into the community. So donate locally would be my first thing. But the second thing would also be to have patience with us. And that's something that I've been hearing from my youth a lot of, I am not okay, and I need you to have patience with me. So as I'm on this call, I was also writing a grant, and I was also like setting up all these other meetings for my youth. And so, for me, it's a matter of, for me personally, it's a matter, and I mean, my youth also captured it right, of you need to be patient with us, because right now, it is hard. It is hard to exist. It's hard to be in nonprofit world. It's hard to just be a person. And so, it's amazing that there's so many orgs out there that are quickly responding. But for some of us, we just need more time, because it's just so much, and there's just no way to describe, yes, I need legal resources. If there's any lawyers on this call, I'm looking at you, any immigration lawyers, making eye contact with you, because I need your help. But also recognizing that some of these issues have pre-existed COVID, right? Some of these issues have long been set up in a strategic, systematic way for what is currently happening to happen. It is not a coincidence that it's mostly communities of color that are very much impacted by this work. So just having that context, I think, is very helpful, because then I don't have to spend time explaining it to people, and they can understand immediately. Okay, here's what I need to do. I need to figure out how to do cop watch. I need to figure out how do we connect our youth to resources, to counselors that they need. I need to figure out how to get, again, immigration lawyers. I'm looking at you. I want to see you. I want to have a conversation with you. So that would be my answer.
That's a great answer. And part of what we do as a network is we also try to connect people with other people who are doing work or already doing something that you might be interested in starting, so that you don't have to reinvent the wheel. So, we have Mohamed, who says that they've successfully done so many, like 22 cases for queer and trans Caribbean folks seeking asylum. Like, reach out to Mohamed, ask him who his lawyers are.
Yeah, oh my gosh, Mohamed.
Yeah,
Yeah.
I'm an immigrant. I have an immigration lawyer. She's amazing. I connect you with her. I tell people she's the fabulous lawyer all the time. You know, everyone on the call is a resource. And that's what the Cancer Network has been doing, using our platform to give voices to LGBTQ orgs who need to be heard in this pandemic because they're not counting us. We don't know how many LGBTQ people have died or really struggled with COVID-19 in this pandemic. We don't know how many people haven't been able to go back to their chosen family because, you know, maybe their schools were closed and their dorms just sent them home and they couldn't make it to people who would support them and keep them safe. And I think, you know, many people who aren't familiar with like queer, trans culture and what it means to also be a person of color that's been sort of colonialized and taught to be homophobic and transphobic, how violent, difficult it is to be in homes that, you know, have sort of been told you're going to go to hell by just loving someone. So,
you
know, I just want people to know that, you know, these intersectional identities or these layers of vulnerabilities are impacting LGBTQ people of color in a greater way. And we're not counting them. And that's something that, you know, at the National LGBT Cancer Network, we want them to count us. We want to know the queer and trans people of color, the queer, trans, bi, you know, youth that are, you know, unsafe at home and seek out care. They go to the hospital, they're seeking mental health. So thank you so much for the work that you do and for saying that we need a break to collect ourselves before we jump into this pandemic, right? We're all working in crisis, and while we're all responding to it, we're still in crisis. And we have to acknowledge that because people of color have been in crisis for centuries. And, and, you know, this pandemic has really, really sort of shone a light on those disparities, which is why we're convening these webinars to show these disparities as like evidence of this discrimination. If you didn't think it existed before, you can see and who's getting sick and who's dying, right? So we're gonna open this up for all of everyone who has questions to ask Vanessa any questions, or any of our speakers any more questions. Vanessa, before we switch to everyone else, sort of like, is there one thing you would want someone, you know, our funders or whoever on the call to take away, some sort of action that they can do to help support some of the work that you need support to do?
I mean, I think ultimately at the end of the day, what's really important to know is who is leading this work, right? Because something that has been very frustrating for me at least is that being a part of the Amore network, we're not getting the funding that we need. We're still, you know, in crisis mode of trying to get this funding. And so for us, for funders, for people who are seeking to donate, you know, is who you're donating to, is it going to directly impacted people because it's being led by directed impacted people? And it's not a terrible time to bring this up. At the same time, like, it's a conversation that we need to have about how funding works in ways that I saw somebody in the chat was talking about how, like, you know, East Village, New York gets so much funding, but the Caribbean Equality Project doesn't. And so there is a factor of race happening there, right? There is a factor of who is more fundable, who has a better aesthetic to then be showcasing to donors. And so for me, one thing I would strongly encourage folks to look at is, are the people who are directly being impacted by this work the ones that you are choosing to give your money to? Because if the answer is no, then how do you trust that that money will make it to the people who need it the most, or resources, or whatever you're donating? So that would be my spiel, which is something that PRISM talks about a lot, is we need to have directly impacted folks leading the work.
Thank you so much, Vanessa. I mean, it's also just, you know, really sad that organizations that have a lot of unpaid staff are creating relief funds and giving money to the community rather than paying themselves, right?
Exactly.
Yeah. Thank you so much. We have 10 more minutes. I just want to go through our last few slides, and then you can please ask your questions in the question box, and our speakers are still here. They can answer any questions directed at them about the work that they do. So just a reminder, the National LGBT Cancer Network is one of the CDC-funded disparity networks, and so we're the LGBTQ disparity network. And we partner with state departments of health, LGBT orgs, to get information to our LGBTQ communities about their higher risk and vulnerability for tobacco-related cancers, because we know that our community, because of the increased rates of smoking, we're more vulnerable to most cancers and most diseases. Michelle, next slide. And in response to what's happening in communities of color and queer communities of color, we've created these 3 social media shareables that's available to anyone who wants them, that gives you material to put out there in your communities, on your social media, that really talks about who this pandemic is affecting, like who is the most vulnerable. And so you can see much of the topics that were brought up by our speakers are sort of covered by these shareables. Masks won't shield us from racism. Health disparities are a result of discrimination, and COVID-19 has definitely unmasked existing inequalities. Michelle, next slide. This webinar is in a series of other webinars where we highlight the impact of COVID-19 on LGBTQ people, LGBTQ communities. And so we have social media kits related to each one of the subtopics for the past webinars. And this is just a sample of what we've created that sort of gets our community to understand social distancing, why we need to wear masks, and then to just sort of like let our community see themselves represented in materials to keep us safe. That way we're more likely to use them. So feel free to visit our website or reach out to me, Karen@cancer-network.org, to get access to any of this material. And they're also available in Spanish. Michelle, next slide. And as part of our COVID-19 response, we've put out information about what LGBTQ communities need to thrive. And so we started off with an open letter that was signed on by over 100 LGBTQ orgs across the country, talking about the impact of COVID on our communities. Our second letter was signed by 170 LGBTQ orgs, asking to protect us from discrimination, to collect data on LGBTQ people, and to talk about the economic harms that we're experiencing. So feel free to go look at these letters, sign on. The more people that are asking for LGBTQ people to be counted, the more likely we will be counted. And when we're counted, we can advocate for ourselves. Michelle, next slide. And this is the team at the National LGBT Cancer Network. You've met Michelle, Aria, and myself. Our executive director is Liz Margulies, and our deputy director is Scout. And I believe they might both be on the call, but I'm not sure. We've got about 6 more minutes. I'm going to open it up for questions. And if our speakers could put their video back on, that would be really great, so people can see you if you're still here, to respond to any questions.
So this is Michelle. We had someone ask Vanessa a question in the chat box, and Vanessa, I'm just wondering if you would be able to respond to that. The attendee was asking about if there was a decrease in youth engagement during this time.
Yeah, we are definitely seeing that decrease of youth engagement. Our youth have to go online Zoom classes all day, and then to ask them to, hey, can you join another 2-hour Zoom call to talk about how we can, you know, make sure that school is equitable for y'all, is just too much. And so they've expressed, you know, give me patience. My mental health is just non-existent right now. some of them have even had to get jobs because their families don't have jobs anymore. So yeah, if y'all have any creative ways for us to engage youth, like I'm ready to take notes, so hit me up.
Thank you. I can actually unmute folks, or people can use the raise hand function if there are other people on the call that have questions.
There's a question for Rae asking, do your clients need food, masks, and gloves? I guess it would be, if they do, how would someone get those to you?
So first off, we don't use clients, we use community members because these are people. They're not numbers, right? We actually have been working locally with a group of folks that have been coordinating creating masks and working with local community leaders, and have been able to disseminate about 200 masks out into the community based off of need. Right now, nobody has actually talked to us about gloves, like needing gloves. They're mostly concerned about the masks, and we're really trying to get a hold of hand sanitizer. If you have access to hand sanitizer that we can disseminate to people in the community, that would be extremely helpful. And then a lot of our folks, actually, we work with networks of mutual aid organizing that's happening in the Mid-Hudson Valley. So we've been able to direct people to get those kinds of resources. The mutual aid networks that are up here are fairly robust, and we haven't come across some of the issues that have surfaced in mutual aid networks. Some of our work, because of the mutual aid networks being so robust, is that we are coordinating with folks who grow food to think about the long-term impacts of access to food in the future. And so we're working with a bunch of different folks who have different capacities to grow, and also working to start to cultivate some donors that can donate things like plants or like containers for container gardens and stuff like that. So if anybody is interested in potentially donating those kinds of things, like that would be extremely helpful. The food issue in our communities, because as everybody has said on this call, access to food or food sovereignty is a huge problem. We have the benefit of space because we're like urban rural, but we have also the disadvantage of being a community of color, and we deal with environmental justice issues. And so all of our land, for the most part, has high lead in it, right? So we can't plant things right into the ground. And so we're just thinking in the future about those kinds of things. And at this moment, I have to say we're pretty lucky. We've been very lucky with getting a hold of things like masks, but things like hand sanitizer and soap are really things that we need. And I think my email is connected to the login information. I don't know how this works. Unfortunately, I'm like super Zoom inclined, which is kind of terrible in a lot of ways. But I can figure out how to get the Cancer Network team to drop my email into the chat, so that way people can access it, and then you can reach out directly to us if you have access to those kinds of things, which I'm sure the other folks that are sitting on the call likely need access to those things too. We don't, as soon as this thing happened, like we were scrambling to get toilet paper to people. It's been a nightmare, honestly. And at least our communities are resilient enough that we support each other. So we help each other because we understand what it's like to live in an oppressive system where you're seen as an outsider and resources aren't allocated to us, and we figure out a way. We're survivors.
Thank you so much, Rae. We have a question where someone was asking, how is this impacting sex workers? If any of you know.
So yeah, we also have a number of sex workers that have applied to our COVID-19 fund. Yesterday, we had a 17-year-old that's living in the Ali Forney Center shelter system that applied to our fund. And she is from Jamaica, doesn't have any family here in New York City. And She was doing survival sex work for about 6 months. She's only been in the country for 6 months, and immediately turned to like sex work just to survive. We also work with one of our board members. Her name is Cayenne Dorashow, who is a sex workers' rights advocate in New York City and throughout the country. She's the founder of GLITZ, and we've been able to get referral from GLITZ. Cayenne has been sending community members to us who are Caribbean, trans, sex workers, non-trans sex workers, to apply to our funds. And we're seeing an increase in that community that knows that's been like holding and building us, and that has letter of movement for the past 50 years. They're also impacted by COVID-19 in multiple ways that we haven't even addressed on this call today. But I think many organizations are seeing sex workers reaching out for support. They're not able to access clients and access work the way they used to. And as a result, they're also experiencing food insecurity in addition to all of the financial impact of the COVID-19 is bringing, coupled with like mental health, right? So these are all issues that, in addition to us as being cisgender, myself being a cisgender queer person, sex workers are also dealing with the same challenges, if not more.
Thanks, Mohamed. Michelle, there's a question about if we know or are aware of any city-states actively collecting LGBTQ plus data as it relates to COVID-19. I know this is what we've been advocating for, but I don't know if someone or anywhere has actually done that.
So I believe that Pennsylvania actually just passed something that requires that collection today. And so that should be, folks can see that on social media. And then I know that California, a senator there that was on our last webinar, Senator Scott Wiener, has been advocating for that. And Scout is on the call. So Scout, if you know of any other locations that are adding that as mandatory, feel free to jump in. I know New Jersey.
Thanks. We hear that New York City might be adding it potentially. That was announced on a recent phone call. We know that the state of Washington is putting it out on a COVID survey. The state of New Mexico is adding it to their existing survey. And we are getting some information that like the city of Chicago is doing it, things like that. So I would say it's probably a real time to highlight data collection. And if you don't have any movement on it in your area, now's the time to bring it up to people. The model in Pennsylvania was really successful, and you can copy the letter that they got like 26 community signers on in 2 days, sent it to their Department of Health, and ultimately got data collection moving. So that letter is open for you to copy. We can send a link out related to that. Bradbury Sullivan did a great job with that.
I also just wanted to let folks know, we did have an additional speaker set for this webinar, Candy Brings Plenty, and unfortunately Candy became sick today, so was unable to join us.
Feel better, Candy.
Thanks, Mohamed.
Yes.
Candy was going to talk about the impact of COVID-19 on her local Indigenous population, as well as Indigenous populations across the country, which, you know, if you're not following the news on the impact of COVID-19 in Indigenous populations, I think you should. Definitely. You can see the health disparities amongst communities of color and Indigenous populations as a result of discrimination in the number of people who are sick and how our populations, our communities go unserved. So we're about 4 minutes over our end time. This has been a personally very important conversation to be had. If I had more time and more organizers, hopefully we could change the world in one webinar, apparently, but we can't. We still have about 60 people who have stuck it out with us. Thank you so much for taking time to talk about the work you're doing and the fabulous work that you're doing, all of you, while also struggling in this pandemic with all of us. Thank you so much for your work. I know my colleagues and I when we were planning this, we were like, this is the most important webinar. We want to use our platform to give a voice to our communities who don't get heard far and wide enough. There's still some big LGBTQ orgs on this call. Please feel free to reach out to any of these organizations with ideas of how you can support the Cancer Network. We're national, but we're tiny and very strong, and you know, the way we're doing it is using our platform to give a voice to our community members. And if we send any funders your way, yay. I hope that happens. And so Thank you so much. If you guys have any parting words or thoughts, you have negative 4 minutes. So or there's Aria.
Right quick, I just also want to note that New Jersey also introduced legislation to require LGBT data collection for COVID as well. So they've been a big partner of ours, and I just wanted to make sure that they were also noted.
Thank you.
That's right. Yeah, New Jersey.
Rae, let's make New York do this.
We also typically send out a link to the recording of the webinar with a transcript in the coming days. So we'll have links to the websites of folks who are presenting today and any additional information that came up on the webinar. You'll be getting an email about that.
Well, thank you all so much for having us.
Yeah. Thank you. Thank you for taking time out of your day. We genuinely appreciate it.
No, thank you for creating the space for us, particularly for a growing immigrant organization to have a national platform. Doing this work for the past 5 years with Caribbean Equality Project. The one thing I didn't say this year, we're celebrating 5 years. In September, we were planning our very first fundraising gala. The theme for it was immigrant justice and equity, but that's going to be postponed for 2021 because we still deserve to celebrate the work we're doing and to celebrate our community we're serving. And I just want to say, prior to COVID-19, we have always known that our vulnerable Caribbean LGBTQ immigrant community have always been frontline workers and essential workers in New York City. Coronavirus has just amplified and magnified that, and we are trying to our best to be resilient and responding to the emerging needs of our community. And I really thank all of y'all and the LGBT Cancer National Network for just creating this space for us today. And Karen, thank you so much, my fellow queer Caribbean person. I am so grateful for this space. Thank you.
Yeah, just again, thank you for the space and being, again, a small organization that is so, like, we're just spread out all over the place because that's just the nature of what it means to live in like a rural climate, and still working just as hard, if not harder, to address those needs and bridge that gap. So thank you all for this work and for being in conversation with such amazing leaders and learning so much about what it is that you all are doing in different areas, literally just an hour and a half or 2 hours away. So
you're all invited to come visit me in Beacon in the Hudson Valley.
Beacon. Karen wants everyone to come visit her. We're going to take you up on that.
So we're just wrapping up. Thank you so much, and have a great rest of your week. Stay safe and take lots of vitamin C and whatever supplements you can, and sleep when you can.
Thank you, everyone.
Thank you.
Bye.
Thank you.
Be
Take care. Be well.
Bye.
Bye.
Bye.